Third.
Hi, my name is Aleks Simic. Today we'll be performing a neurological and abdomen exam on our patient here, aka Mr. Smith. Mr. Smith, before we begin, do you agree to be videotaped today?
Yes.
Okay, thank you. A few questions to start off with. Do you or have you had any frequent or severe headaches?
No.
No. Any severe head injuries in the past?
No.
Any numbness or tingling?
No.
No. Any history of seizures?
No.
Okay, thank you. So we're going to begin by assessing cranial nerve 1, which is the assessment of smell. Mr. Smith, I'm going to have you close your eyes for me. I'm going to place a familiar odor of scent underneath your nose, and you let me know what it is that you smell.
Vanilla.
Okay, good. Thank you. Next, we're going to be assessing cranial nerves 3, 4, and 6, which is going to be the 6 cardinal fields of vision. Here's my pen. Mr. Smith, I'm going to have you stare at the tip of the pen, and I'm just going to have you follow the tip of the pen with your eyes, keeping your head straight, looking forward. Again, I am noting here endpoint nystagmus at the extreme laterals, which is normal. Okay, thank you. Next, we will be assessing cranial nerve 5, which is facial sensation and the muscles of mastication. Okay, Mr. Smith. When you feel something on you, just say now.
No. No. No.
Okay, thank you. Next, we're going to check for the muscles of mastication. I'm going to have you clench your teeth, feeling both sides feeling equally bilaterally. And now I'm going to have you try and open your mouth, keeping your mouth closed. Okay, good. I was not able to open it. Thank you. Next, we'll be assessing cranial nerve 7, which is for facial movement. I'm going to have you smile. Okay, can you frown for me? And let me have you pucker your lips. And then can you puff your cheeks for me? Okay, keep like that. I'm going to push, expelling the air, coming out equally. Next, we will assess cranial nerve 8, which is going to be a hearing assessment. We're going to complete the whisper test. I'm going to stand on each side of your ear, and I'm going to whisper a mix of 3 numbers and letters. And then once I say them, I'll have you repeat them to me.
2, 3A.
Good. We'll come to this side.
2, 3F.
Okay, thank you. Next, we will be assessing cranial nerves 9 and 10. I'm going to use our tongue depressor here. Well, first, let me have you open your mouth, tongue out, and say ah, noting the uvula is in midline position. And then next, we're going to test for the gag reflex. I'm going to put this in the back. Okay, good. That's positive. Thank you. Next, we will be assessing cranial nerves 11, the sternomastoid and trapezius muscle strength. I'm going to hold on to your chin here and let me have you push against my arm opposite way. Good. Let me come on this side. Good. Strength is equal bilaterally. And now I'm going to push down your shoulders. I'm going to have you shrug your shoulders up. Good. Again. Okay, now shrug your shoulders for me. I'm going to push down. Okay, good. Thank you. Next assessment is we're going to be assessing cranial nerves 12. Next, we'll be assessing cranial nerve 12, the hypoglossal nerve. Mr. Smith, let me have you stick your tongue out. Okay, no tremors in the midline. And now let me have you repeat the words light, tight, dynamite.
Light, tight, dynamite.
Okay, speech is clear. Thank you. Next, we'll be going on to the deep tendon reflexes. First, we're going to start with the bicep tendon. Okay, Mr. Smith. What do we have here? Okay, good. Feeling that Mr. Smith contracted his arm at the bicep. Next, we're going to test your tricep reflex. I'm going to have you dangle your arm. Leave it there just like that. Okay, good. Thank you. And the next tendon is going to be the patellar tendon. And I'm going to have you keep that leg loose. Okay, good. Thank you. And the last one is going to be the Achilles. I'm going to have you externally rotate that just like that. And then striking the Achilles tendon, feeling with the patient, flex the foot. And for the last tendon, the superficial tendon reflex, we'll be checking for a negative Babinski. The Babinski is found in infants up to children at the age of 2. And here, can you see from there? Okay. Starting at the bottom, going out, noting that Mr. Smith's toes curled in, which is correct, normal finding. And now we're going to check muscle strength, push and pull. So Mr. Smith, I'm going to have you raise your arm up just like this, and then I'm going to have you pull your arm towards you. Good. Let me have you push back. Good. Checking both arms. Pull towards you. Good. Push back. Good. And now let me have you stick your arms out in front. I'm going to have you push up. Okay, good. Push down. Very good. And now, Mr. Smith, I'm going to have you lay on the floor here so we can show the lower extremities. Okay, I'm going to have you put your feet, legs straight out. And I'm going to have you push against my hands like you're pushing down the gas pedal. Good. Pull your toes towards you. Very good. Equal bilaterally. Thank you. Okay, Mr. Smith, let me have you stand back up. And now we're going to assess your gait. I'm going to have you stand nice and tall, look forward from me, and I'm going to have you walk, complete 15 to 20 steps, one foot in front of the other. Okay? And here we're assessing, balance is good. Okay, Mr. Smith, let me have you turn and come back towards me. Good. Okay, thank you. Let me have you have a seat. And here we have all normal findings, and that will conclude our neurological assessment. Thank you.